My name is Lenida Reyes. I'm a student at Humber College taking Nephrology 1511 course under Professor Shayalini Jivakaran. And in this video, I want to talk about peritoneal dialysis catheters care plan. In less than 10 minutes from watching this video, the viewer should be able to learn about different peritoneal dialysis catheter, type of material catheter is made of, think of catheter is the catheter of choice in peritoneal dialysis. There's rationale, advantage and disadvantages, pre-insertion preparation of the patients, pre-operative care of the patients, post-operative care of the patients, long-term care of the exit site, patient's point of view. There are different peritoneal dialysis catheters. There are swan neck catheter, Toronto Western catheter, as well as Tinkoff catheter. Swan neck catheter is a downward pointing segment. Migration is rare and serves to help outflow, and it prevents infection through pointing downward to inhibit perspiration and pulse. The Toronto Western catheter, it has two discs to prevent migration. It has also diaphragm flange, a bead which is sewn in position by purse string suture to prevent leaks at the exit site. But the choice of catheter is the Tinhoff catheter. Tinhoff catheter is the commonly used worldwide. It's used in Canada, US, Mexico, Europe, and Australia. 65% of this catheter are implanted globally. It's made of silicone due to its good biocompatibility. Tinhoff catheter is a shorter catheter, straight and curved catheter. These also include either single or double to help seal the openings through the peritoneum. The rationale is Tinhoff are widely used because it's easily inserted under local or general anesthesia. Tinhoff catheter has outer segment that connect the adapter to the solution transfer catheters. Intramural segment diaphragm cuffs has 8 centimeter apart to decrease seepage and prevent bacteria from inflowing into catheter. It has also intraperitoneal part. It has small holes for in and outflow of the solution. The advantages of this catheter is has a lower incidence of infection, provide rapid inflow and outflow from peritoneal cavity without leakage. It reduces dislocation rate, which means reduced hospital visits of the patients. While disadvantages, catheter tip migration rather with dysfunction. It has risk for infections like peritonitis and exit site. It also has complications like dialysate leaks, hemoperitoneum hernia, scrotal edema for male, prolapsed uterus of the female, and tunnel infection. The pre-insertion preparation of the patients. For the site, sitting or standing is the best posture. The nurse should ask the patient's preference whether above or below the belt line. Skin folds and abdominal scars should be prevented. The catheter exit site should be situated where the patient can easily clean and maintain exit site, which is very important. Marking the site before the operation were performed by peritoneal dialysis nurse. Preoperative care of the patients. Patients should bath or shower before the insertion. They have to clip abdominal hair instead of razor. They have to empty the bladder. Prevent constipation such as giving stool softener. Screening of bacteria. Prophylactic antibiotics. Psychological preparations of the patients. Marking the exit site. And of education of patient undergoing surgery for peritoneal dialysis. This is important so that patients are prepared what their expectation after surgery. The post-operative care of the patients are use disinfectants like iodine to clean the exit site, immobilize the catheter to prevent trauma within 7 to 10 days, minimize pressure in the abdomen, change the dressing in 5 to 7 days after surgery to improve recovery. Flush 500 to 1,500 ml of PD fluid to check patency after insertion. Cap off using a small locking cap on the catheter adapter and left covered until PD commences. The long-term care of the exit sites is to avoid swimming, bathing, or visiting sauna. This is to prevent fluid uh, entering into the surgical site. Patients should also avoid contact sports because this is to prevent from any bruising or anything that could hurt the patients. Avoid lifting heavy objects to prevent ruptures. Avoid strong wound cleanser because it might affect uh, the wound. Exit site should keep from dry to prevent from any bacteria. Good fixation of the catheter is also needed to immobilize the incision site or the catheter in the incision site. Patient's point of view. Patients are afraid of getting infections and receiving complications, being inconvenience and unwholesome self-body image. Peritoneal dialysis is best preferred by patients because it is convenient. They can do the procedure while sleeping. They can also go for a holiday. Patients need to know what is peritoneal dialysis and why it is important. Teach patients connect the peritoneal dialysis, help patients to become independent, especially when nurses are not available for them. Patients need encouragement. For instance, being with catheter affects their self-image, especially women. Usually women suffer from low self-esteem. Support of the nurse are matters and important. Teach patients how to do aseptic technique to prevent infections such as peritonitis. Kidney dialysis should support life functions and not overwhelm the lives of the patients. Good relationship between nurse and patients are important. Patients are wants to be cared, compassion, and trust from nurses. And that's everything. Thank you.